Hydrochlorothiazide is a medication used to treat high blood pressure. It helps prevent strokes, heart attacks, and kidney problems by lowering high blood pressure. It belongs to a class of drugs known as diuretics, or water pills, and works by causing you to make more urine, helping your body get rid of extra salt and water. In addition to treating high blood pressure, it can also reduce extra fluid in the body caused by conditions such as heart failure, liver disease, or kidney disease. This can lessen symptoms such as shortness of breath or swelling in your ankles or feet. The daily dosage and optimal timing for taking this medication should be determined by your healthcare provider. When taking hydrochlorothiazide, it's important to follow your doctor's instructions. Usually, you'll take it once a day in the morning, with or without food. Taking it too close to bedtime may cause you to wake up to urinate, so it's best to take it at least 4 hours before bedtime. The dosage will depend on your medical condition and how you respond to the treatment. It's important to take this medication regularly to get the most benefit from it. Try to take it at the same time each day, even if you feel well. Many people with high blood pressure don't feel sick. If you're also taking certain drugs to lower your cholesterol, such as cholestyramine or cholestyramine, it's important to take hydrochlorothiazide at least 4 hours before or 4 to 6 hours after these medications. Make sure to keep your doctor informed about your condition. If your blood pressure readings remain high or increase, or if you don't feel better, let your doctor know. As your body gets used to the medication, you might experience an upset stomach, dizziness, or headache. If any of these effects last or get worse, tell your doctor or pharmacist right away. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits to you outweigh the risks of side effects. However, if you experience any serious side effects such as a decrease in vision or eye pain, be sure to inform your doctor immediately. This medication may also cause dehydration and electrolyte imbalance. If you notice symptoms such as extreme thirst, very dry mouth, muscle cramps or weakness, irregular heartbeat, confusion, or decreased urination, it's important to contact your doctor right away. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects. If you notice any other effects, be sure to contact your doctor or pharmacist for advice. And if you experience any side effects, you can report them to the FDA in the US or Health Canada in Canada. Before starting hydrochlorothiazide, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. It's important to also share your medical history with your doctor, especially if you have diabetes, gout, kidney disease, liver disease, lupus, or skin cancer. Hydrochlorothiazide may make you feel dizzy, and alcohol or marijuana can make this worse. It's important to avoid driving or using machinery until you know how this medication affects you. Also, be cautious with alcohol and speak to your doctor if you use marijuana. This medication can increase the risk of dehydration, so it's important to drink plenty of fluids unless your doctor advises otherwise. If you have diabetes, hydrochlorothiazide may affect your blood sugar levels, so make sure to check your blood sugar regularly. Hydrochlorothiazide can also decrease your potassium levels. Speak to your doctor about how to maintain healthy potassium levels, such as eating foods high in potassium or using a potassium supplement. Additionally, this medication can make you more sensitive to the sun, so it's important to limit your time in the sun and use sunscreen. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications you are taking. If you are an older adult, you may be more sensitive to the effects of this medication, especially dizziness. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of taking hydrochlorothiazide with your doctor. It's important to be aware of the potential interactions of hydrochlorothiazide with other medications. This can affect how well your medications work and may increase your risk of experiencing serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medications without your doctor's approval. Some products that may interact with hydrochlorothiazide include dofetilide and lithium. Additionally, there are some products that contain ingredients that could raise your blood pressure or worsen your swelling. It's important to inform your pharmacist about all the products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen or naproxen. It's also important to note that hydrochlorothiazide may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are taking this medication. And, remember always to consult your doctor for the best time to take this medication and the proper dosage. If you or someone else has taken too much hydrochlorothiazide and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., you can call 1-800-222-1222 for assistance, while Canadian residents can reach out to their provincial poison control center. Symptoms of an overdose may include severe dizziness, weakness, and fainting. Remember that you should not share this medication with others. Making some lifestyle changes, such as exercising, quitting smoking, and following a low cholesterol/low-fat diet, can help this medication work better for you. It's important to consult your doctor for more details on these lifestyle changes. While taking this medication, you may need to undergo lab and/or medical tests, such as checking your potassium levels, kidney function, and having skin exams. Make sure to keep all your medical and lab appointments and consult your doctor for more details. It's also important to regularly check your blood pressure and heart rate while taking this medication. You can learn how to check these at home and share the results with your doctor. This will help you and your doctor monitor your health and the effectiveness of the medication. If you forget to take a dose of hydrochlorothiazide, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. When storing hydrochlorothiazide, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and ensure it's kept out of reach of children and pets. If you no longer need the medication or it has expired, it's important to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.